Matt, M-A-T-T, last name Biersack, B as in boy, I-E-R-S-A-C-K. I am the president and chief medical officer at Mercy Health St. Mary's.
So you guys are right now experiencing near capacity, if not full capacity at 99%. What does that mean for you moving forward?
What it means is that we're having to take rather drastic measures in order to continue routine care. As of today, it means that we have had to cancel multiple elective surgical procedures, orthopedic procedures, joint replacement surgery, bariatric procedures, and others over the next week and a half in order to open up hospital capacity to care for more patients. In this case, more patients that are diagnosed with COVID-19.
We've seen statistics from Spectrum, their 7-day rolling average, 22.6%, the highest they've seen since the pandemic began. How does today's stat of 21 or 22.1% compare to what you've seen historically?
Historically, we haven't seen these rates of county positivity within our system since last fall, so approximately a year ago. And unfortunately, what we're not seeing is that there's any leveling off of the curve. We're continuing all the 3 health systems and the county just seeing upward rise in terms of the positivity rate. And that's really, really concerning because we also know that there's quite a bit of testing that's going on outside of the systems with home testing that we weren't seeing a year ago. And so it's likely underrepresenting the degree of transmission that's really happening.
So we're seeing people label this as a 4th wave. One thing you just said that stuck out to me is that it's almost underrepresenting. Do you think that would you feel safe calling this a 4th wave? And do you think it's actually worse than the numbers we're seeing?
I definitely think it's a 4th wave. And I think, the inpatient numbers that we're seeing now are close to, if not in some cases, exceeding the worst that we've seen yet since the pandemic began. So we're seeing a number of inpatients now at Mercy Health St. Mary's that we haven't seen since November of 2020. And so we're really concerned about the trends, across the board. And I know that the other health systems are seeing also extraordinarily high numbers of patients. So yes, I would definitely call it a 4th wave.
One thing we're seeing as capacity begins to rise, obviously elective procedures being canceled. What happens when the numbers make it so that's not enough? When you've canceled all those elective procedures and you're still seeing beds filled. Spectrum has talked about converting conference spaces. Are we looking at field hospitals, external locations? What is the plan for if that happens?
Yeah, there's a lot of downstream negative impacts that we'll see if things continue to worsen. So, we mentioned elective procedures. So that means even more procedures that require inpatient stays that would need to be canceled. It means that that nurses, physicians, all of our staff have to do and see more patients than they're normally used to. It means that potentially we would be providing care in alternative care sites, be it conference rooms or hallways, et cetera. It means longer wait times in the emergency department and for seeking routine care. It means that there are times in this community when ambulances have had to bypass one hospital and go to another because emergency rooms are so crowded and there's so much burden. And so those are things that to some extent are already happening, but I think we all are concerned that they're going to continue to get worse unless there's some dramatic change in terms of how we're viewing COVID at this time.
What needs to change to correct that curve?
A few things. One is that we need to continue to vaccinate the community. We're seeing, a number of adults that have not yet been vaccinated. Now we have the opportunity to vaccinate those that are ages 5 to 11. And so we're starting to see that uptick. But the other thing is the simple things that we've been talking about since last March. It's wearing masks when out in public, washing hands, staying a safe distance. There are things that none of us really want to be doing at this point in time, 20 months in. But we have a really serious situation on our hands, and it's going to require all of us as a community to really work together in order to bend this curve.
Would you go as far as looking at the potential of a mask mandate in schools again, if the spread is so bad amongst children?
We know that masks attenuate transmission, between students, one student to the next, one adult to the next. So masks are effective. They've been proven to be effective on a number of different occasions. So we supported the decisions that were made by the county in order to assure that there were masks in schools. Again, it's part of a layered strategy in order to control transmission of this virus. Masks are as important as distancing and hand hygiene and vaccines.
Got it. Those really are all of the questions that I have. Anything else you want to add?
No, I just, my ask would be to stay close to this, Justin. This is, we're seeing a rapidly deteriorating situation in the healthcare community. So, please reach out if we can provide further updates.
Can I ask, what do you mean by rapidly deteriorating?
Well, we had 51 inpatients yesterday. We have 64 as of this morning. We have an emergency room that has 85 patients, and about half of our beds are offline because they're full of hospital patients. Metro is about ready to go on diversion for about the 17th time. I don't know how many times they've done it. And I don't mean that jokingly. I mean that like they've had to. And so what it does is it then translates volumes downtown. We've had to, on a previous occasion, divert to Spectrum. More surgeries will get canceled. I mean, there's a lot of concern that this is the worst that we've actually ever seen, and that we're seeing numbers of patients that we've never cared for before.
In general, like COVID or not, just fully overcorrection or overcorrection, the wrong word.
We've never had this number of patients that have been boarded in an emergency department ever.
It's definitely something to keep watching. I really appreciate you taking the time.
Yeah. Thanks a lot, Justin.
Take care.